Did the federal government just ensure that COVID-19 could last longer and kill more people? I know that wasn't their intent, but I think they blew it on this one. Check it out, leave your comments, ding the bell, share it with your friends, and subscribe to our channel. So did the federal government make a mistake? I say this not as a partisan, but as, because, hey, this is a question about an administration that's run by a Democrat. But by declaring a pause in the distribution of the Johnson & Johnson vaccine, when they had pretty good knowledge that 100% of these cases were in premenopausal women, and we've known for several weeks now as a result of the AstraZeneca experience in Europe, and AstraZeneca uses essentially the same technology as Johnson & Johnson. These are not messenger RNA vaccines like Pfizer and Moderna. These are instead vaccines that use what's called an adenovirus, a common cold virus that contains a piece of a fragment of DNA from that produces a protein from the virus or that's similar to the virus that causes an immune response in the body. So they're more like old-fashioned vaccines, the Johnson & Johnson and the AstraZeneca. And so we've known for several weeks that the AstraZeneca one causes, in again, very, very vanishingly rare cases of blood clots in young women. And now we're seeing the same thing with J&J here in the United States. So why did they pause the entire thing? Why not simply say, and I'm guessing that they will very, very soon. Again, I'm not a scientist and I'm not trying to present myself as one. I'm basing this all on like basically publicly available stuff. But why, instead of pausing the vaccine, which creates this whole national headline, why didn't they say, if you are a woman under 40 or a premenopausal woman, just to be super safe, if you are a woman who has not yet experienced menopause, you should take Pfizer or Moderna rather than J&J. And everybody else, all you men out there, all you women who are post-childbearing age, go for it. The J&J vaccine is just as good as anything else. I get it, and I heard the excuse yesterday because Chris Hayes essentially asked this same question and asked it rather hard of one of the administration officials that, haven't you possibly done more harm in the context of the memes? And the response was, well, we do this all the time with vaccines. We'll roll a vaccine out, and after a couple of months, clinical trials are like 30,000 people, 50,000 people, 100,000 people. But you roll a vaccine out, now you've got 2 million people vaccinated. It's a much larger, it's basically kind of, the ultimate beta test, right? And you've got a much larger group of people who are now getting the vaccine. And now, if you've got genuinely rare side effects, things that will not be detected except by just good luck, in a 30,000 person test or a 60,000 person test. Now that we're at a 1 million person test, we can find the 1 in a million examples. It's very hard to find those in the 30,000 person samples. And so, they'll roll out a new vaccine for shingles, or they'll roll out a new vaccine for herpes virus, or, something that is not just a blockbuster that everybody in America is paying attention to. A lot of these vaccines that we're taking and that we have given to our children have, in the course of their lifetimes, been paused. As scientific evidence comes in, hey, it looks like we're starting to see this side effect associated with these vaccines. But at the same time, keep in mind, if a young woman takes birth control pills, and this is the same birth control pill age cohort, if they take birth control pills, their risks of getting a blood clot are massively higher than from the vaccine. We don't know yet that the vaccine actually caused those blood clots. It might have been all these women were on birth control pills, which produced this kind of outcome in, I've seen stats of 1 in 10,000, I've seen stats of 1 in 30,000. It doesn't matter. It's rare, but it's not anywhere near as rare as 1 in a million. So did the federal government make a huge mistake by saying we're going to pause this and just hand to the Republicans who don't want Americans to get vaccinated because they do want the economy to continue to be in crisis so that they can use the economy as an election effort in 2022 and 2024. This is the piece that I published today over at hartmannreport.com. And you can read it, you can share it with your friends. It's no cost, there's no ads, nothing. It's all right there. And I lay it out, with links and details and everything. If my hypothesis is correct, and Nate Silver basically just took this on with a CNN medical expert. Nate Silver was like, you just might have caused millions of Americans not to get vaccinated by adding to the anti-vaccine hysteria with this pause, when you could have simply come out and said, we're going to pause it for women under 40 or under 50. I guess it's under 50. 49 was the cutoff age. We're going to pause this vaccine for women under 50, but everybody else, it's fine. It's good. I think that from a political point of view, I get the science, that vaccines, you just pause the vaccine as soon as you have side effects. Fine. But this is not a normal time. This is not a normal vaccine. This is something that everybody in America is paying attention to. Everybody in America wasn't paying attention to the shingles vaccine when they paused it, if that's, one of the examples. Or any of them. I mean, if they paused an MMR, a measles, mumps, rubella, if they paused, something, a tetanus shot. I mean, we don't know because we don't pay attention to that. But the whole country is watching the J&J vaccine. And now the world. And using the weight of the federal government, they just came out and said, no, we're going to cut it off for everybody, even though there's not a single case of a man getting a blood clot from this disease or a woman over 50 getting a blood clot, from this vaccine. Not one single case. And we've got 6 people out of 1 million who have gotten a blood clot. 1 died, 1's hospitalized. The other 4 people are fine. So we've got 2 people out of 1 million who were seriously harmed by the J&J vaccine, both of them young women. Why doesn't the government just say that? I mean, I'm talking total transparency here. But by pausing this, and Nate Silver took my position on this. We don't want to feed the Republican meme machine because the Republicans want people not to get vaccinated because the Republicans are invested in keeping the economy screwed up, keeping the country functionally shut down. I mean, you can declare the country's wide open, but, there are people who will not go into stores until we have herd immunity, who are not going to feel comfortable sitting in a restaurant and eating without a mask on. And you can count me in that until we have herd immunity or until those restaurants are using vaccine passports to get in. I have no intention of being one of those 5% of people who had the AstraZeneca vaccine and can still get infected. And even if it's not going to put me in the hospital or kill me, I don't want this infection, number one. And if I'm hanging out with my kids and grandkids, I don't want to be passing it along to them. And not everybody in our family, we've got young children in our family, they are not vaccinated. And they can't get vaccinated, at least at the moment. So I think that they made a strategic blunder. In my opinion, they should have gotten some political feedback before they did this, not because I want politics controlling science, but because politics can actually damage science when the science is working in that political era or field or realm. And let's be clear. The COVID vaccine is the political realm. It is being handled like a football by the Republicans to try to discourage people from getting vaccinated, to try to keep people from, to try to keep the economy from opening back up. It's very simple.
This is the Thom Hartmann Program.
And we need to acknowledge it, and we need to put it into the equation when we're talking about public health issues. Do you think I'm crazy here or wrong on this? Let me know.